Hi, my name is Dr. Chantel Branson, and today I will be talking about the clinical practice guidelines for telemedicine implementation. So basically, just to get started, I wanted to provide my perspective as a clinician providing the services for telemedicine to my patients. So it may not directly apply depending on the type of physician that you are. I am a neurologist by training, and therefore my specialty is a little bit more focused, but I do want to provide some general information. With getting started with telemedicine, basically making sure that the office that you're in, the company that you're working with, or who is helping providing the services can assure privacy of the patient data, guaranteeing proper evaluation and treatment of the patient. So if you think that it might be a bit more complex or more challenging, or you haven't been able to really grasp the etiology or cause of the symptoms that the person is having, then maybe that may not be a good person for you to see through telemedicine or telehealth. And also fully verifying and authenticating the location and, to the extent possible, identifying the requesting patient. So just understanding where you're going to have these type of services provided and making sure that the patient is clear on what they need. So whenever a person comes into my office and they're and I'm considering them for a telemedicine visit, I take several things into consideration. Are they living in a very far location from where my office is? Is it difficult for them to get here? Is it traffic? Are they not able to drive because of the specialty that I'm in? Or and then informing them that they would need some sort of a device to use, depending on the type of company or the telemedicine services that you provide. They would need either a phone or a computer, or understanding how to use something to communicate with the provider. So just making sure that they are aware, and at any time if they don't feel comfortable or if there are any issues, giving them the option to particularly changing back to an inpatient or in-person visit. So establishing patient-provider relationship, just to continue that, disclosing and validating the provider's identity and applicable credentials is very important, as discussed previously. Obtaining appropriate consent from requesting patients after disclosures regarding the delivery models and treatment methods or limitations, including any special informed consents regarding the use of telemedicine technologies. This might be more for the person who may have some memory problems, or might be considered someone who needs more support or understanding, may have some challenges with understanding the questions or how to use them in telemedicine, telehealth visit. And then just a few important considerations, important to ensure that you're able to do a proper evaluation, as stated before, understanding your patient population and the person that might be adequate for the type of evaluation or visit that you will be performing via telemedicine or telehealth. Consultation and then prescribed treatment are all thoroughly documented in the patient's medical record and electronic health record. So just making sure that you document it just like you would a normal in-person visit. If the evaluation, diagnosis, or treatment will be too complicated, as I stated before, for telemedicine service, giving them the option to request it, even after you've already decided that, and they have decided that they would be a good fit for telemedicine. If they call back or they contact you or the visit or the clinic, just have that option ready and available for them. So follow-up care. Follow-up care should be available to the patient, either telemedicine follow-up. So for example, for me, I do Botox. So I would perform the Botox for a patient who has any movement problems. That's my specialty or background training, is in movement disorders or migraines, and then I may have them do a telemedicine follow-up in 6 weeks before the next Botox treatment or therapy is indicated, just to see how they're doing. So that would not, you also have to be mindful of the time depending on the company. Some companies have you do a 15 or a 30-minute visit. If it's more of a 15-minute visit, then, once again, this is something where it is a simple question or evaluation and not something that is more complicated. Also in-person follow-up and with another provider. Documentation from the visit should be accessible to the patient, and be prepared to share information with another provider of choice recommended by the patients. And once again, this is all very generalized information. You may or may not have a provider that you can share that information with. So just making sure that it's accurately documented in the EHR, in your electronic health record, so that everyone is clear about what the treatment evaluation was for. And once again, prescribing. Considering the possible absence of a physical exam, understanding that patient safety is so important. Once again, you're going to have to determine which patients would apply for you and decide if that person would be adequate to prescribe the medications via telemedicine or telehealth. And once you can start to do it, you'll get a good feel for it. Prescribing medications considered safe by the Physician State Board. Also, you have to understand what laws are appropriate for your particular state that you live in. And all medications prescribed must be done at the professional discretion of the physician, as stated before. Telemedicine providers should have knowledge of the availability of medications in the patient's geographic location and the other providers caring of the patient. Caution should be exercised in prescribing medications that require close monitoring or that could lead to acute changes in a patient's condition, particularly if the patient is not in close proximity to a health facility or healthcare provider. And once again, this goes back to the discretion of your particular field in medicine, your patient population, and how it will relate to a telehealth or a telemedicine patient. So you would have to really, determine what your particular state, their laws, the state laws, and how it will work for your particular institution. Thank you.